My name is Cindy Robinson. This is my PowerPoint on leadership skills for today's nurse. If you will, take my pretest first. I'm a nursing student for Indiana State University. There's a growing fear in the healthcare field that there is an impending nursing shortage. There are two major reasons for this: a growing number of experienced retiring nurses and incoming fresh out-of-school nurses. According to the CDC and the NIH, it is essential that nurses also be groomed for leadership roles due to a loss of so many. There is also a growing opinion in the field that suggests that nurses should be partners with all professionals, including physicians. The NCBI recognizes the nurse as the essential vessel for effective, optimal health care. It is increasingly common everyday practice for interdependence in healthcare. Many problems require complex solutions that involve more than one discipline. This requires the nursing profession to acquire a new style of leading. According to the NCBI, nursing leaders must be partners with others of the care team, including physicians. This inspires collaboration and respect. The Joint Commission states that this style of nurse leadership is associated with improvements in patient care, improvements in medical errors, and less burnout. All interdisciplinary teams must work together towards the goal. The transformational leader inspires confidence and respect, motivates, inspires loyalty via a mutual vision for the workplace, results in more morale improvements, less burnout, productivity improvements. The NCBI recognizes this style of leadership as fostering environment for patient safety, improves nursing experience through much less turnover. The autocratic leadership doesn't share decision making, and mistakes are unacceptable. The laissez-faire leadership, this leadership does not make decisions for staff, does not inspire much change. The transactional leader strives for change, strives for increase in productivity. The task-oriented leader is continuous planning and continually monitors for need of change. The relationship-oriented leader supports team members, recognizes accomplishments, and constant morale-building activities. The Institute of Medicine recognizes 6 components of optimal care that must be incorporated into leadership: safe, reliable, efficient, effective, patient-centered, and equitable. One of the most critical components of a successful patient outcome is an effective leadership style. It inspires a high rate of patient satisfaction, high morale, reduction of medical error, and indirectly reduces adverse patient outcomes by retaining staff, therefore increasing expertise. An effective leader practices in a hands-on approach and is associated with significant increase in patient satisfaction, quality of care, and safety. Measurement of patient outcome is a core assessment in quality of care. The National Quality Measures Clearinghouse defines patient outcome as the end result of health care. Its mortality rate, satisfaction, length of stay, medication error, management of pain, patient falls, and nosocomial infections. According to Regis College, the incoming new nurses will comprise at least 50% of the U.S. nursing pool. There are many alliances in the nursing field who are advocating for the development of new nurses in leadership. A 2010 Gallup poll found the national consensus is that nurses should have more persuasion and control in decision-making for the safety and care of their patients, because the nurse plays a critical role in patient care. He or she possesses critical knowledge that others do not possess. The essential skills of a leader. First, a nursing leader requires emotional intelligence. This requires the development of effective coping mechanisms to deal with the emotional stressors that come with everyday nursing. Without such coping mechanisms, the nursing profession can lead to becoming emotionally exhausted, which can lead to low morale, burnout, and ineffective care. Present leaders must work with new nurses to develop this skill. The second is the nursing leader must possess integrity. Integrity is essential when making critical decisions on care. Always doing the right thing, even when no one is looking. The nursing leader with integrity teaches those around him or her ethically guided practice. The next is critical thinking. It leads to sound decision making when faced with many factors. Critical thinking is a necessary component of collaboration in multidisciplinary healthcare. Nurses are often faced with situations in when they must make quick decisions based on changing patient conditions. Dedication to excellence. The nursing leader must be committed to excellence of care. The nursing leader must require top-notch care from those around her or him. Many facilities require regular performance evaluations. This helps to foster an environment indicative of this trait. The leader must require oneself to strive each shift for providing the best care possible for each patient. The nursing leader must possess optimal communication skills. The nursing field is increasingly involved in multidisciplinary care, which requires the ability to effectively communicate. These skills can be learned by doing rounds with the different teams. Collaboration effectiveness is key to intricate patient healthcare issues. According to a study by Kinnaman and Bleak, diverse interdisciplinary collaboration fosters the environment for higher standards of care. Effective communication can mean the difference between life and death. There must be leaders from all settings in nursing for truly effective outcomes. You must know how to advocate for patient and family effectively, how to effectively collaborate, how to follow instruction from further up the chain of command. The leadership of the nurse is essential to the quality of care delivered. The hands-on care given by the nursing leader is vital to outcome and the learning environment that exists in healthcare. The nursing leadership role must strive towards constant improvements, innovation in practice, work with the legislative level to improve healthcare laws, and permit nurses to provide optimal care. Find areas in policy that can be improved upon. Apply new research findings to policy. The autonomous nature of community nursing makes leadership roles particularly important. This is due to familiarity with the patient and family. Other multidisciplinary team members may not have time as a luxury. Nurses have the best first-hand knowledge and experience, which allows for tailored responses to the individual. Professional socialization is key to leadership. It refers to how we relate to and communicate with patients. It's essential in gaining the trust of our patients. The nurse-patient relationship begins from the moment of introduction. The patient must know we value their health. The nurse leader must view themselves as a partner to the physician as well as other team members, essential at bedside. The nurse leader inspires respect from those around her or him. The nurse leader fosters an environment in which respect is a two-way street, whether with subordinates, management, or patients. Effective communication is a key component of mutual respect. Leaders use motivational techniques that appeal to the individual. Leaders understand the importance of constant learning and provide subordinates with learning opportunities and autonomy. Professionalism. The leader must be confident as the supervisor and in patient care. Must be competent, must exude professional characteristics when in contact with all teams. Thank you.